Hello everyone and welcome to Chalk Talk Tutorials. In this video I'm gonna explain you about the convalescent plasma therapy, a new treatment for COVID-19. Before moving ahead, let's take a look on recent data. That is, approximately 4 million people are affected globally and 21 lakh people died due to this pandemic. Therefore, the whole world is waiting for a new vaccine to treat COVID-19 effectively. But unfortunately, there is no such vaccine available to treat COVID-19 patients effectively. Well, in this world of advanced medical techniques, is vaccination the only way to cure COVID-19? Not really. There are some other methods are also available to cure COVID-19 patients very effectively and very quickly. One of them is convalescent plasma therapy, and this is the topic of our today's video. So make sure to watch this video until the end. Before moving ahead, we must know some important things about plasma. Plasma is the liquid portion of blood. About 55% of our blood is plasma. It is yellowish in color and it has the properties of blood clotting. And it is composed of 95% from water, and it contains 6 to 8% proteins like albumin, globulin, fibrinogens, etc. Well, what is convalescent plasma therapy? People who have recovered from COVID-19 successfully have antibodies to the disease in their blood plasma, and doctors call this as convalescent plasma. Researchers hope that convalescent plasma can be given to the people with severe COVID-19 symptoms to boost their ability to fight with the virus. Well, this was the overview of convalescent plasma therapy. Moving ahead, we have a question that how does it work? When a person is infected with the coronavirus or COVID-19, their immune system produces antibodies against that infection and releases them into plasma. After making enough amount of antibodies, that person is cured of that infection successfully, and the plasma of this cured person can be transfused to another infected person to treat them very effectively. This convalescent plasma therapy was also used to treat 1918 flu epidemic, SARS, MERS, H1N1 virus and H1N5 virus very effectively. Let's take a look on effectiveness of this convalescent plasma therapy. During a clinical trial in China, a 200 ml dose of convalescent plasma was administered to 10 adult COVID-19 patients with severe symptoms. The patient witnessed significant improvement with the disappearance of virus, reported among 7 patients without any severe adverse side effect. But the limitation is that this is a temporary immunity and lasts only for few days to few weeks. But the vaccination provides lifelong immunity. That's why vaccines are very effective in treatment of any kind of diseases. Now, if we take a look of our country, the Indian Council of Medical Research (ICMR) has given the nod to Kerala to conduct plasma therapy. Kerala is the first state in the country to have been given the nod to try this out, as a task force was already in place. So far, ICMR does not recommend it as a treatment option outside of clinical trials. As the world is waiting for a vaccine against coronavirus or COVID-19 with bated breath, it remains to see if this method can provide a much needed shortcut in finding a cure. Well, this was all about convalescent plasma therapy. What are your views on this plasma therapy? You can write your views in comment section, and if you found this video useful, then press the like button and share this video on different social media platforms like Facebook, Twitter, YouTube, etc. Make sure to subscribe our YouTube channel for more updates like this. Thanks for watching this video.